mercury removal has to be done very safely. Especially if you have some in the mouth, it's really important that they're done using the SMART protocol. And the reason for that is that mercury can and is released during the extraction process. So in my practice, what we do is we isolate the tooth. There's external air, there's ionic air in our office, so that way anything that comes out gets filtered. Also, we don't actually drill out the mercury. We put incisions and pop them out, so that way we don't actually drill them, so there's not a lot of aerosol involved, or also a lot of particles, because that's when the mercury vapor is created, and mercury vapor is actually really toxic. That's the stuff that the vapor can actually get absorbed through your skin, and it goes into your body, and when it goes into your body, it actually binds your amino acids. And when it does that, like for example, if you were going to, let's say on the traffic light, there's red, green, and yellow. What the mercury vapor would do is it would go ahead and bind to the red and make it a green. So you would never have any stop signs. You would just keep going. So you can see what chaos it would cause in our society, right? If we had no red lights, everyone would be going all at the same time. So that's kind of like what mercury vapor does into our system. It binds to glutathione, which is an amino acid. And so I also make sure that my patients have a protocol to remove it, which is usually working with a naturopath, or also using charcoal, and then also vitamins A, D, E, and K in order to make sure that anything that's stored in the body is actually removed as well. So we follow a specific protocol made by the IAOMT in order to safely remove mercury, because mercury is known to be toxic for many reasons, and it's known to cause low birth defects, it's known to cause Alzheimer's, and a lot of other issues. So it's something that should be really done properly.
So to back up, is the mercury buildup inside of the tooth, or where is it?
It's in the body, the mercury, because every time you have the mercury, so if the mercury sits in the mouth, every time you have a hot cup of tea, because of the heat, it will release vapors. Every time you're grinding, it will release vapors, and that your body will absorb. And what mercury does, it deposits, and it deposits into the brain a lot, the myelin sheaths. And so that's why it's linked to Alzheimer's. And so it deposits in certain areas of the body. So that's the main reason why mercury is so toxic.
Okay. Are there ways to avoid mercury from accumulating?
The best way to do, obviously get the mercury fillings removed is number one. The second way to avoid mercury toxicity or overload of mercury is going to be to avoid the fish. And so if you're avoiding fish or tuna fish or canned fish, anything like that, to avoid all of those, that would be huge. The other thing that I also recommend is a detox, a metal or mercury detox. That is very, very, very key. A lot of times mercury is bound to copper or different metals. And so when there's a heavy metal detox that's done, it'll help release the mercury that may be stored in the body as well.